Hello and welcome to another video looking at the bones of the upper limb. We have already looked at the bones of the arm and the forearm in the video in the description below. We will now have a look at the clavicle and the scapula, or more commonly known as the collarbone and the shoulder blade, which are collectively known as the shoulder girdle. We will start by having a look at the clavicle, as this is the more medial bone of the two. The clavicle is palpable along the entire length. The sternal end is the medial end as it attaches to the sternum or the breastbone. This end is strong, robust and quadrangular in shape. The acromial end attaches to part of the scapula, which we will look at in more detail later in this video. This end is flat. As we have a look at the clavicle, about 1/3 from the lateral acromial end is a bony protrusion called the conoid tubercle, and then a groove called the trapezoid line. We will look at the importance of these when we look at attachments between the scapula and the clavicle. On the medial side is an impression for where the clavicle articulates with the ribs. There is also one last bony prominence called the deltoid tubercle, an attachment point for the deltoid muscle. Before we move on to have a look at the scapula, pause the video and have a go at this question, writing the answer in the comments section below. Describe the appearance of the sternal end of the clavicle. That's right, it's robust and quadrangular. Let's have a look at the second bony part of the shoulder girdle, the scapula. We will start with the anterior view. The most inferior point is called the inferior angle, and the most superior point of the main body is the superior angle. You can remember these as they are points much like angles are. The main body of the scapula is like a triangle, with the most superior surface being the superior border, this vertical medial side being the medial border, and the angled lateral side is the lateral border. The inner part of that anterior triangle is indented, and this is known as the subscapular fossa. Let's have a look at this complicated part of the scapula. There is one hollowed out section called the glenoid cavity. It is here where the head of the humerus sits to form the glenohumeral joint. There are also two projections, an anterior one called the coracoid process and a posterior one called the acromion. Let's move on to the posterior surface. Leading into the acromion is this bony ridge called the spine of the scapula. This divides the scapula into two sections, the superior supraspinous fossa, which sits superior to that spine, or the inferior infraspinous fossa. Lastly, from this posterior view, you can see one feature much clearer, the suprascapular notch. This is found on the superior border just before the coracoid process forms. Before we move on to how the clavicle and scapula interact, pause this video and have a go at this question, posting your answers in the comment section below. What is the name of the posterior bony projection of the scapula? That's right, it was the acromion. Let's finish off by looking at the ligaments that form between the clavicle and the scapula. At the acromial end of the scapula, there the clavicle articulates, forming the acromioclavicular ligament. The clue for that one really is in the name. The next ligament is commonly known as the coracoclavicular ligament, forming between the coracoid process and the clavicle, but it is in fact two separate ligaments. Remember the conoid tubercle and the trapezoid line we talked about earlier? This is where they reappear. There is a ligament that forms between the conoid tubercle of the clavicle and the coracoid process of the scapula, and this is called the conoid ligament. There is another ligament that forms between the coracoid process and the trapezoid line, called the trapezoid ligament, and together they are known as a coracoclavicular ligament. I hope you have found this video useful. If you have enjoyed it, then please like and subscribe so we can make our videos more often and better. See you next time.